Why use theories in clinical practice? I think throughout this semester, I realized that different theories are more specific to different circumstances of the patient, whether that be the condition that they're in or the circumstance that they're in with a family member or a diagnosis. I think we can use them to customize and even at times use different parts of theories to really make sure that we're covering all of our bases for our patient and promoting their health in a way that's individual to them and yet has a system approach so that they know that we are using a systems approach and that we want them to reach the specific outcome of that they are hoping for and that they wish for. Does theory use make a difference in care? I think theory use makes a huge difference in care. I think of it almost like a blueprint, and that's what I also notice about this semester is that they're almost like guidelines or, like I said, blueprints for the nurse to use and really bring us back to why we are choosing to be nurses in the first place. I think there's a lot of historical value in many of these theories and the research that was done by each of the theorists to get to the point of producing these theories. How do you know if a nurse was using a theory to support working with a patient? I think I would see a level of advocacy that we may have not normally experienced in a lot of our clinicals because of the lack of nurses and lack of healthcare providers in hospitals. But every once in a while, I meet a nurse who I can see that they are thinking of a theory or that they usually use a type of or a specific theory that is applicable to the types of patients that they have on their floor. It also can be individualized to, say, like a clinical care setting versus an ICU setting. You can see how different parts of care is emphasized depending on the situation or condition the patient has. What would you notice if a nurse was not using theory to support working with the patient? On the flip side, I think I would notice it with nurses who are just trying to get the job done and clock in and clock out and finish whatever tasks they have without really making a connection with their patient and performing patient-centered care. I think I would also see them not being uh, having great communication skills with their patient or with other interdisciplinary team members. How could use theory in the clinical setting? Um, how could theory use in the clinical setting impact nursing quality, safety indicators, and patient outcomes? Um, at times, I think it may be difficult to decide which nursing theories are most appropriate given the position of the nurse, whether you're a nurse manager or a nurse practitioner. Um, Nola Pender's health promotion model nursing theory may be most appropriate for clinic settings, focusing on that health promotion and health prevention or disease prevention. Whereas Florence Nightingale's environmental theory may be more appropriate for designing protocols or hospital systems to avoid errors or in disease control to help identify safety issues and promote health. I think when it comes to nursing quality and patient outcomes, the most safe, efficient, and patient-centered care is the ultimate hope in the future of nursing, and that should always be our forefront as nurses is which way can we make, how can we send our patient home thinking that they had the most high quality of care and the safest care, and that they were always the center of our attention, and that their outcome of being healthy, safe, and feeling as if they really were a part of our family while they were on the unit, and that we liked seeing them and taking care of them, but that we don't want them to be sick and in a hospital, and we want to see them living their full life at home with their family.